Welcome back, everyone. How was everybody's lunch? Thumbs up? Two thumbs up? Very good. And again, those mini desserts, you can't go wrong with those, right? Hashtag winning. Speaking of hashtags, guys, want to remind you that we would love to be tagged in all of your photos here at part of the event. Please use the hashtag pound health, the number 2CONF, short for conference. And of course, that way you can share in all of the memories made with friends and colleagues that weren't able to be here with you. So we're going to get right back into it. We've got so many great things coming up this afternoon for you, more panels, keynotes, and of course, our last award session and our cocktail hour to wrap up the end of the evening. Right now, we have a special keynote by Sean K. Shahkarami, founder and CEO of Opilio. He's going to share his insights on the topic, the art and science of increasing revenue in healthcare. Diving into the world of healthcare, it's fascinating to see how hospitals and clinics navigate the delicate balance of providing top notch care while keeping their financial health in check. This is why our keynote speaker will explore the ingenious ways these organizations manage to boost their income, from harnessing cutting edge technologies to finding creative solutions for patient care. It's not just about the numbers, it's about sustaining a system that saves lives and maintains the well being of all communities. Please put your hands together for Sean.
Thank you, everybody. Thank you for having me here. Thank you for being here. And look, I get it. Right after lunch, I'm sleepy too. Believe it or not, I actually am humbled to be on the stage. Was not planning on it. So if you saw my keynote yesterday at a different conference, please bear with me today. This is a little bit of improv that I put together. But this is something that's near and dear to my heart. This is my business. This is my primary source of income, but it's also built to really change and help transform the way that the United States delivers and provides quality health care over the course of the next few years. Now, when we think of the state of our healthcare system, most people would say that there's some brokenness in it. I'm pretty optimistic, so I'm not going to say it's fully broken. But how many in this room think that our healthcare system is broken? The vast, vast majority. I've spent over 10 and a half years in healthcare management consulting, healthcare finance, doing mergers and acquisitions. I've seen the vertical consolidation where you actually have payers purchasing into healthcare providers, which, by the way, finally did make headlines, at least somewhat, on the heels of the Change Healthcare hack. Are we all aware of what happened the last few weeks with the Change Healthcare and the hack of Optum and UHC, which I start there because that's really where Opilio was born. The idea was born. And I started with this grand vision of a healthcare AI kind of 2.0 revenue cycle management company. Uh, because of my experience in healthcare reimbursements, I'm able to understand the complexities, especially in managed care, to where I have created models that are able to predict future cash collections within 1% accuracy. And it's not even just the number being accurate, it's able to forecast to the exact day when a provider is going to receive that cash and to which invoice level detail it's going to be attributed to, right? So my background is in modeling to the penny healthcare future cash collections. Now, what I found was the buzzword of AI opens a lot of doors, but the industry needs a lot of education. And not only that, the industry has already been burned by many fly by night companies coming up and talking about how great their AI is and how it's going to solve all these issues, combined with the cybersecurity threats with protected health information. And then you look at the relationships or the lack of relationships between the providers and the clinicians and the actual payers themselves. I have clients, and I'm talking sophisticated clients, clients making over $100 million of revenue a year that are private equity backed, operating in more than 5 states, that didn't really know what in the hell is going on with their contracts, with their fee schedules. It's a mess. But if I could boil it down, this is all technical stuff, which is very, very important. The technical aspect is important. But if I can boil it down, the number one problem in healthcare is there's a lack of trust. And it's only been magnified by the COVID-19 pandemic, because now we have patients who don't trust their doctors. You have doctors who don't trust their payers. You have payers who don't trust the regulators and the DOJ and CMS, the Centers for Medicare and Medicaid Services. Everywhere you look within our healthcare system is a lack of trust. So what builds trust? And I'm not talking about the things that I talked about in my last keynote from a motivational perspective. I'm talking about in commercial business dialogue, what builds trust? Transparency. One of the reasons why the United States and some other Western countries have such a great system, an engine that creates wealth, is because of transparency. If you still to this day go to Far Eastern nations, and I'm not saying it's bad, it's a cultural thing, there's no judgment here, but you can go to the supermarket, which some things are way better about those supermarkets, but there's no price. You pick up the apple and you say 10 cents, and the merchant says no, 30 cents, and then you say 15 cents, and the merchant says no, 20 cents, and you say deal. United States, there's transparency. You walk into a supermarket, it says 25 cents for the apple. You either want the apple bad enough to spend a quarter on it or you don't. It's transparent. In healthcare, we lack that transparency until now. So what my company has found is leveraging the 2021 price transparency law, which, by the way, a lot of providers who are really focused on providing quality care to their patients don't really fully understand, is that for the first time, we can know what other providers in the same geography, in the same taxonomy, providing the same service from the same payer are getting paid. Never before did we have that type of transparency. Now, I'll be honest, when the Price Transparency Act rolled through, you can bet the insurance carriers weren't exactly thrilled about it. So it is paywalled, but we purchased the market data, and guess what? We don't take ownership of that market data. It's a shared ownership. It's a pass-through expense to us. We give it directly to our client as well. So our client now has, for the entire state, for their specialty, for their taxonomy, for their CPT codes and specialties, they know exactly what each and every competitor are being reimbursed by Blue Cross Blue Shield, United, Aetna, Cigna, Humana, any other smaller commercial payer for the exact same service. It's very simple. But of course, like most things in healthcare, because of the volume of data, there's a large gap between simple and easy. What do I mean by that? Well, if you're a general practitioner, an orthopedic surgeon, or a neurosurgeon, and you practice in the state of Texas or California or even Oklahoma, and you're going to get all of this market data, it typically comes in 30 to 40 to 50 CSV files, and it's 20, 30, 40, 50, 100 million rows of data. So what my company has done is we've partnered with a public company called Domo. Domo provides us the engine in which that data can be efficiently managed in a HIPAA compliant version, which, even better news, we don't need any PHI. It's all price transparency, publicly made data once you pay the price for it. Safe, secure, doesn't require any PHI, and we can analyze that 30, 40, 50, 100 million rows of data in a matter of days or weeks if there's added complexity to it. right? So what do we do? Now that we have the transparency, we need to identify. I liken it to a good real estate agent to keep it as simple as possible. How many of us have a home? Now, some states, how many of us live in a state where you pay property taxes on your home? Is your favorite time of year March or April where the county appraiser drives down your street and they slap a property value on your home, right? Kind of stinks when you see it. But let me ask you this. Would you ever use that tax appraisal to sell your home? You would? Maybe. Okay. Most people wouldn't. The reason why most people wouldn't is because they're going to have a professional realtor come into their home and say, wow, I love that you refinished and kept the original hardwood floors. I can tell, wow, you did a magnificent job redoing your kitchen, right? And they're going to find the comparables out of the 100 homes in your neighborhood. They're going to find the 5 or 6 direct comparables to your home to help you get the highest selling price, right? So that's kind of what we're doing. It's the science of it. We're siphoning through the data, sifting through it, and we're identifying. Step one is identifying what is going to bring your practice max value. We live in a world of diminishing returns, and it's easy to get lost and to stop seeing the forest for the trees. So we want to find the direct competitors that are going to position you as the lowest paid provider. Because once we position you as the lowest paid provider, we can now drive a very simple, actually, statistical model, given the whole population of reimbursements, and benchmark you against your competitors. From there, we get into my favorite part, which is the art. We go to the insurance companies on behalf of our clients and we negotiate. It's typically done well with the network manager relationships that Opilio has now, especially with Blue Cross Blue Shield or Anthem, depending on your state, and United Healthcare or Optum, depending on your state. We can get that process done pretty quickly. And we negotiate on the provider's behalf. And right now, we're averaging 12% increases in the reimbursement rates. But the outcome, as powerful as it is not as powerful as the trust and the rapport that's being built. Some anecdotal stories are small world. I got a call last week, an investor in my company. His wife's an LPC, solo practitioner. So it's great. This model works for solo practitioners, part-time solo practitioners, all the way up to highly sophisticated private equity-backed hospital and medical groups. Calls me, goes, Sean, you'll never believe what United's doing to my wife. And I said, what's United doing to your wife? He goes, well, they're not even going to pay her the Medicare rate. I said, okay, what's the Medicare rate? I said, it's $150 for 90837, which is an hour-long psychotherapy visit, if I remember correctly. And I said, Brandon, number one, Medicare pays 80% of that $150. So they are paying you the Medicare rate. I said, number two, and I'm going to change your name. I said, are you by any chance working with Alicia? And he goes, how'd you know? I said, well, because I know Alicia, because I've worked with her before. I said, she's a great woman. I said, Brandon, did you know that she has a 7 or 8-month-old baby who's going through sleep regression just like you? He's a new dad. He goes, no, I didn't know that. I said, yeah. I said, did you know that she's had some things going on in her personal life? I said, so why don't you send me what you sent to her for your rate proposal? So he sends me the email. In the first line, he writes, previous to our first demand. And I stopped. And I said, Brandon, since when did you get your JD? Are you an attorney all of a sudden? He goes, no. What are you talking about? I said, your first line. I said, who's going to work with you? You are demanding something out of a woman who is just doing her job and who doesn't have full control, just by the way, because there's directors above her. And I said, she's already given you a 15% increase, and now you're making a demand, and you don't even know her personally. So he goes, Sean, well, tell me what I should do. And I said, speak to her like a human being. The reason I bring up this story is because a lot of my clients feel as if the insurance company is a villain. And I'm not going to sit and defend every decision of a large insurance company. I know they can be a hassle. I know it can be a pain in the butt. The good contract managers, network managers out there, they know it too. They know it too. But making demands, usurping their process, going outside of the boundaries of the procedures that they've already set forth is not going to help you. But developing relationships between probably the most important potential, and I'm going to use potential here, potential partner you have, is something that has been frowned upon for years and years and years. What other industry do you not try to develop a good relationship with the counterparty that pays you? And maybe there are some out there, but I can't think of any off the top of my head. But in healthcare, it is well known to have an adversarial or confrontational or just no relationship at all with the very hand that feeds you as a provider. Like I said, it's not always a walk in the park. Not every network manager is the easiest to work with. However, just following the simple rules let out in Dale Carnegie's famous book, How to Win Friends and Influence People, will move the needle more than the most robust, sophisticated AI machine learning spreadsheet in the world. I promise you that. But when you combine the two together and you partner with a company who has the relationships and who can build that trust, help build that trust for you, that's where you're going to get disproportionate rewards. So all that to say is everything in life is a negotiation. And it doesn't have to be confrontational. It doesn't have to be adversarial. It can be, but it doesn't have to be. And so what we've done is we've created a framework, a breakthrough process where we combine the art and the science of strategic negotiations to increase the revenue in healthcare. And we do that on a risk-free pay-for-performance model. So what do I mean by that? Other than the market data, you don't pay us a thing. We are so confident in our ability, in our relationships, in our technology, in what we're able to do. Thanks, Google AI. They're always listening. That we take a small percentage only of the value we add at the end of the negotiation. And I understand that a 12% increase might mean a couple $1,000,000 or more to your practice, but it doesn't just fall from the sky the day that you sign your name on the new contract on the new fee schedule. What we do is we look at the fee schedule and we divide that number by 12 and we bill it out monthly. To my knowledge, there's no one who's even close to what we're doing or what we've come up with. So I've made it as simple as possible. If this is something that could help you or help someone you know, we do give a referral commission for any successful referral. We hand out, depending on size and scale, anywhere from $1,000 to $2,000. If you just pull out your phone, text Opilio, Opilio. You text message Opilio to 844-721-1940, 844-721-1940. I'm going to send you our exact framework. You can do it yourself if you want to, for free. Thank you so much, guys. Thank you for being here. I'm honored. God bless.